Hello, this is Dr. Robert Bouvier with Dr. and You, and this video is primarily about how to keep people out of the hospital. So why would I make a video about this? Well, I was asked to. And what was funny is I was asked by quite a few hospital administrators to make this video. Why would a hospital administrator be interested in keeping people out of the hospital, right? Well, they're getting penalized for people ending back in the hospital if they were just in the hospital for some specific sicknesses, and it's costing them a lot of money. And we've been very good about how to keep people out of the hospital and follow up with that. Employers who are self-funded are very interested in how to keep people out of the hospital for a very specific reason. It's the same reason insurance companies want to know how to keep people out of the hospital, because of the $2.7 trillion. That's 2.7 trillion. A lot of zeros after 2.7. $2.7 trillion. 40 to 45% of that money is spent by hospitals. Another issue is 10% of the patients spend 70% of the money in healthcare. These are just some well-known statistics, pretty much the same with whatever region of the country you go into and with whatever insurance company you're talking about, including Medicare. So 10% of the money spent in healthcare, or 10% of the patients spend 70% of the money, the $2.7 trillion. So other people that were interested in how to keep people out of the hospital were the patients themselves. They don't want to go in the hospital, majority of them. They'd rather get their diagnostic workup, their care, out of the hospital. They'd rather sleep in their own bed rather than the hospital bed. They'd rather eat they'd rather eat their own food than hospital food. And the list goes on. I mean, you already know a lot of that. Another reason is, there's a lot more sick people in the hospital. Chance of getting infections, chance of getting wrong medications, because the complexity, the rules and regulations that surround us now in healthcare are very complex. So at Dr. and You, we found a way to kind of break that complexity down into a simple format, and we've been able to make ourselves available as concierge doctors to take care of sick people. Most of us are emergency room or ICU trained, so we understand about fractures and lacerations, temperatures, abdominal pain, headache, things like this that would normally take you to the emergency room. You can go see your Dr. and You doctor, because we've made time available for you during the day and even many times at night to see you. And so you can take care of those. You can expect your Dr. and You doctor to take care of you on the same day that you get sick. We've been able to use a lot of the modern technology to not make things more complex, but actually we've been able to simplify the process, the logistics, the demands, the rules and regulations that surround healthcare. We've been able to simplify that so we can spend more time with patients and take care of all your needs rather than jump in, jump out, and really not getting taken care of when you go see your doctor at the doctor's office. So ways of helping people stay out of the hospital is very simple. And probably the number one thing that we do when somebody is initially discharged from the hospital, and this is important for hospital administrators as well, is that we make sure that we have zero tolerance for medication errors. Medication errors. Well, why would that be so important? Well, it's the number one problem for discharge. The number one issue that seems to plague us as healthcare providers and physicians. Let me give you a statistic. Whenever I audit a hospital, and I'll tell you what, I've audited numerous hospitals in numerous states throughout the union, and this dates back 10 years to even currently. There's anywhere between a 90 to 95% medication error rate within the first 2 days of discharge from the hospital. Let me say that again. There's a 90 to 95% medication error rate with most discharges from the hospital within the first 2 days of discharge. So give me an example of that, right? An example would be, well, number one, the ER or the hospital didn't get the medications that the patient was on first when the patient came into the hospital. That's the number one reason. Another reason is that the hospital medication formulary or pharmacy formulary is not the same, or the drugs that the patient's on are not included in that hospital formulary, so they're exchanged and they're sent home with what they were taking at the hospital, and there's duplication now of the same kind of medication when the patient goes home. The patient couldn't afford the new medication that the doctor put them on. It was not on formulary with their insurance company, so they spend 2 days trying to get it okayed by the insurance company. The list goes on and on and on why there's a 90 to 95% medication error rate for people who are discharged from the hospital. So here at Dr. and You, with transitional care management, we've been able to simplify things, but really finely and look at the details of the medications people are on at discharge to make sure, doubly sure and triply sure, that things are correct, both with the patient and with the outpatient doctor. So other ways to keep people out of the hospital. Doctor, make yourself available when the patients are sick. At Dr. and You, it's our agreement. It's why we exist. When you're sick, we're there to help you, and we keep time open, and we spend as much time as we need to take care of you when you are sick. That's one of the benefits of a concierge service like Dr. and You, to take care of people when they're sick, so we spend enough time to be able to do that. Other things are, we make lab, x-ray, IV therapy, occupational speech, other therapies, about everything we can do as an outpatient. We make it available to you the same day, or the same day you're discharged from the hospital, or same day to you. We make all these things accessible, so we don't have to go in the hospital to pull this, to pull this all together for you in a diagnostic workup. We can actually expedite your care as an outpatient because we are able to take the time with you to do it right. And since we know you as your primary care physician, we can expedite that care. A lot of other reasons, but I think it all comes down to we decrease the complexity. We take the time to listen to you to take care of things. We have been trained, personally myself, I've got over 20,000 hours in the emergency department and intensive care unit. I understand about sickness. I've been in primary care since the early 1990s. I understand about alternative care, acupuncture, naturopathic, homeopathic, chiropractic. We know the best providers of those modalities in the area. We're available when you're sick. It's very simple. So that's basically how we can keep people out of the hospital. People are more prone to come to us earlier in their sickness because they know that we can get a hold of. We can help people stay. We can help people stay out of the hospital. One of the other things that we do, we make ourselves available via Skype. We make ourselves available by telephone, 24/7, 365. We really are strongly engaged in telemedicine and mobile health. And lastly, what I'd like to talk about is the thing about the kit. In fact, if you go to Dr. and You, that's www.drandyou.com, and click on the kit in part of our services, and you'll learn a little bit more about it. But basically, it's a medication kit and medical kit that we send home with you, specifically designed to take care of the what-ifs that happen to you. Some people have certain disease states that they themselves don't know how to use IV Lasix or an IV diuretic, but the people around you, the paramedic and the home health care people, know how to use it. So we make it available in your medical kit at your home or on your person when you travel. This time of year, we make sure that all of our Dr. and You patients have Tamiflu available to them, just in case they get that fever, chill, sore throat, cough thing, that shaking chill, so they know they've got the flu. Well, you know that you're supposed to take that medication within 12 hours. When can you get to the pharmacy and to your doctor to get the prescription if you don't have it already? So those kind of things that we do to help people stay out of the hospital. Another new piece that is just really recently. In fact, it's not even available in most areas across the United States, except for places in Texas, Minneapolis, Maine, and some areas across the United States, is the concept of the community paramedic, or the primary care medic, or I call it the medical paramedic, where the ambulance not only goes to your need when you have an emergency, you call them, but we can also dispatch them 24/7, 365 for when you need an urgent issue taken care of. In the middle of the night, the lung patient, COPD patient, heart patient, they have yet another one of their spells, their exacerbations that traditionally would send them to the hospital, but since you have the medications in your medical kit, or the paramedic has, they can respond to your need within 15 to 20 minutes as an ambulance normally would. So we really utilize the community paramedic to help take care of people in urgent need. So we'll really be able to take these community resources, whatever they are, and apply them to your good health. So that's how we keep you out of the hospital. That's how we keep you healthy, help you living longer and prosperous and healthier. So if you have any more questions about why we do what we do, how to keep people out of the hospital, if you're a hospital administrator, give us a call. We can show you how to take care of that transitional care management piece very effectively. We've got some great statistics about that. If you're a patient, to learn a little bit more about Dr. and You, we can help you with that. And the concierge service, and also the concierge services for businesses and their employees. Maybe I need a doctor, right? If I can help you, let us know. Give us a call at 810-610-7972, 810-610-7972, or email me at robert@robertbouvier.com. Go to the website. Again, this is Dr. Robert Bouvier. Thank you very much.